Did you know that vitamin D isn't just for bone health? Nope, it plays a massive role in immune function, inflammation, and even your gut health. And if you're managing IBD, a vitamin D deficiency could be making things worse. In today's episode, I want to uncover vitamin D impacts on digestion, the microbiome, and inflammation, and what you can do to optimize your levels for better gut health and fewer flares. So stay tuned. Hey friend, welcome to Gut Fix. Are you ready to finally get rid of those debilitating digestive symptoms? Do you catch yourself staying up late Googling things like, what can I eat? Or how do I stop a flare? Or maybe you're just lying awake wondering, how did this ever happen to me? I'm Wendy, and I've been exactly where you are, desperately searching for answers, but determined to find natural solutions. And like you, I was overwhelmed by all the conflicting information out there and unsure of what might really work for me. And so now in this podcast, I'm here to share with you what I've learned, how to listen to your body's signals, and uncover the common mistakes that might be standing in the way of your healing. So grab your favorite drink, pop in your earbuds, and let's dive into your health transformation together. Welcome back to another episode of Gut Fix. So today I wanted to talk about vitamin D deficiencies, and many people think that it is just for bone health. However, it's a very powerful hormone that affects nearly every system in your body, including your gut. And if you are an IBD sufferer, vitamin D might be one of the most important nutrients to optimize fewer flares, better digestion, and improved immune function. My own experience with vitamin D was when I was struggling with IBD, no one ever told me the importance of checking my levels until I sought out functional medicine. And it was then that I actually did, check my levels and found out that yes, indeed, I was low. And so I started supplementing until I got my levels up and I could regulate it myself. And there is, honestly, a global vitamin D deficiency problem. It's even in sunny climates like I live in here in Florida. And because it's primarily because we spend more time indoors, more so than ever, certainly more than our ancestors did. We use sunscreen, and we've been told, and the sun has been villainized, that we're going to get skin cancer and it's going to prematurely age you. And excessively, yes, that can happen. Yet when you use sunscreen, it blocks vitamin D synthesis. And then, of course, our modern diets are very low in natural vitamin D sources. So who's at higher risk? Well, people with darker skin tones, their melanin reduces that vitamin D synthesis. Those who live in northern climates, where they don't get out in the sun certainly a good portion of the year, let's say 50% of the year, and individuals with gut issues like IBD because of the poor absorption. And then pregnant women also tend to be at higher risk for, vitamin D deficiencies. Now, there is an IBD connection. There's many studies that show that people with Crohn's and UC are more likely to have low vitamin D levels compared to the general population. It could be that vitamin D deficiencies actually contribute to IBD symptoms. Who knows? But what I do know is that across the board, almost everyone who has a flare or has IBD, Crohn's active flares, seem to be low in vitamin D. And so what is the role of vitamin D specifically for gut health and for IBD? So vitamin D, we know, regulates the immune system. It helps balance between an overactive immune response, which can lead to autoimmunity like Crohn's and colitis, and also a suppressed one, which will increase your risk for infection. And then, of course, if you are on an immunosuppressant, obviously, as the name states, it suppresses your immune system. If you, in IBD, an overactive immune response is what causes that inflammation in the gut. And there's lots of research out there that suggests that with low vitamin D levels, that's linked to the higher inflammation and the increased IBD severity. Also, vitamin D plays a role in your gut barrier lining. So the lining of the gut, which we've talked about in previous episodes, acts as a barrier between the outside world, or food, bacteria, viruses, fungi, all of that, and your bloodstream. And if that barrier is weak, or known as leaky gut, bacteria and toxins can leak into the bloodstream, and that triggers the inflammation. Vitamin D helps to maintain the integrity of that gut lining. So that will reduce the risk of, leaky gut, therefore excessive inflammation. And then vitamin D and your gut microbiome. There's also research that shows that vitamin D influences the gut microbiome, helping to promote the good bacteria or the beneficial bacteria, and at the same time reducing bad or harmful bacteria. And remember, you need a good solid balance between the two. Most people with IBD obviously have a dysbiosis where the good and the bad are not in alignment. And there's also a study that shows that vitamin D supplementation was found to increase microbial diversity, which is crucial for gut health. And that's why, it's recommended that you rotate your foods around and eat lots of different types of vegetables, different fruits, different proteins, because that helps with your gut diversity. People with IBD, like I mentioned, also tend to have that dysbiosis, or the imbalance in the gut bacteria. So by optimizing vitamin D, that can help to rebalance that microbiome. And then vitamin D and IBD symptoms. So low vitamin D levels have been linked to, more frequent and severe flares of IBD, increased the gut pain and cramping, higher risk for surgery or hospitalization, and then also fatigue, brain fog, and joint pain, which are all very common in IBD complaints, which is some of the things that I experienced, most primarily the fatigue. But by boosting those vitamin D levels, might that help reduce these symptoms? Well, I know for me, in my case, it definitely did. And once again, everybody's different, but there is definitely studies out there and proof to say that yes, that will improve the symptoms. And so when you want to, optimize your vitamin D levels for your gut health, always, and this goes for just about anything, test, don't guess, right? The best way to know where your vitamin D status is to get tested. There's several ways to do that. You can, your GP or your practitioner can order you a simple blood test. Also, there are, at home, just using a blood spot test from just pricking your finger and getting a couple of blood spots. That can also check your vitamin D levels. So there's many ways to get that done. A lot of the labs will consider that, 30 nanograms per milliliter is normal. I would tend to say that that's old data, and it really needs to be minimally 50 to be normal. Then, of course, for IBD, optimal levels need to be even higher. So that might be between 60 and 80 nanograms per milliliter. And so, there's research out there that suggests that levels of 50 may offer more protection against inflammation. And I would have to agree with that. I would even say it's even higher than 50, probably, 60 to 70 range. And then, what works best to optimize your vitamin D levels? Is it sunlight or supplements? Well, sunlight exposure is optimal because it's natural, right? And so you want to really strive for a minimum of 15 to 30 minutes midday sun if you can, depending on your skin tone and the location where you are. Down here in Florida, obviously the sun is a little bit hotter, higher, stronger. So you might want to limit that to 15 minutes. And I'm also very light skinned, so 15 to 20 minutes is pretty good for me. But that can boost your vitamin D levels very naturally. If you live in a northern climate or have IBD related malabsorption issues, sunlight may not do the trick. So you may have to, look at supplementation. Vitamin D3 is the most effective form of vitamin D versus D2, which is less bioavailable. But you want to make sure too that you pair it with vitamin K2, and you want to take it with fat food, certainly, but fat will help with the absorption of it. Now, dietary sources of vitamin D also. So, the best foods or the sources for vitamin D are fatty fish, salmon, sardines, if you can handle sardines. Personally, I am not a sardine fan, but I do love salmon. The yolks of eggs. So if you're eating eggs, don't just go to the egg whites. You want the yolks in there. Mushrooms, especially those that are sun exposed. Fortified dairy products also can be good sources of vitamin D. Now, can your diet alone provide enough? Well, in a lot of cases, no. And that's going back to the beginning of the episode, that's part of the problem of why we are deficient, because our food alone really doesn't provide enough. You would have to eat like a ton of salmon or, half a dozen eggs every day in order to get optimal levels. And that's just really not doable. And so, that begs the question, how much vitamin D do you need? So the Endocrine Society recommends 600 IU per day for adults that are under 70. And then if you're over 70, 800. I'm going to say that is too low. There's lots of experts out there that will, so if you find that data from the Endocrine Society, that is really too low. And it's been kind of debunked many times over. For IBD patients or sufferers, the research suggests that it's more along the lines of 2,000 to 4,000 IU per day. Safe, upper limits around 4,000 to 5,000 per day. But always work with a practitioner and make sure that you do testing to monitor where your levels are. It's very rare that you're going to see vitamin D toxicity, but it can actually happen. It would be more when you're taking very extreme doses, like 10,000 plus IU per day for extended periods of time. That's the other thing too, the very important thing of why you want to get tested, because you don't want to take it too long, just keep taking and taking and taking. You want to make sure of where your levels are. And so, you might be able to cut back with the supplementation and maintain the levels with just the sun and your food. And so, the real issue is not, is when you don't balance your vitamin D with your K2 and magnesium. So final thoughts, vitamin D is crucial for gut health. It's crucial for immune balancing and for reducing the inflammation. And so many people with IBD are deficient. So the very first step is to get tested, see where your levels are, see if you need to supplement. And then, make sure that you're optimizing your vitamin D levels. That can lead to fewer flares, less fatigue, and overall better digestion. And so once again, get your test done for vitamin D levels. Spend more time in the sun if you can. I know it's winter right now. Consider supplementing with D3 and K2, and then focus on eating those vitamin D rich foods. And of course, if you want more help with this on this topic or any other for that matter, just book a consultation on my website, wendyhandy.com, or download my free guide, IBD guide on the go. That's you can get it in the show notes below, or you can go to bit.ly/IBD guide. That's bit.ly, bit.ly/IBD guide. Well, thanks for listening today. Hope you found this information helpful. And until next time, stay happy and stay healthy. Hey friend, I hope today's episode brought you some real value. If it did, would you take just 30 seconds to share it with a friend who might be struggling to get her gut in check? And if you're feeling extra generous, leave me a review on Apple. It absolutely lights me up knowing that this podcast is making a difference for you. All right, it's time for me to grab my protein shake and get my gut happy. I'll see you back here next Tuesday for another episode of Gut Fix. And until then, stay happy and stay healthy.